chronic conditions, chronic illness, for kids and for parents is really, really hard.
It's a life of constant worry, and it's hard. There's some really, really hard times, and it's 24/7.
It requires constant 24/7 management. It takes no holidays, there's no breaks. It doesn't go away on your birthday. It doesn't go away because you go to Disney World. It's always there.
When you are raising children with chronic illness, you will feel overwhelmed. I mean, that's just a part of your story, it's a part of your journey.
It takes a psychological toll on you and the people surrounding you.
Traditionally, medicine and pediatrics has segregated behavioral health into the psychiatry realm and hasn't paid attention. But we're beginning to understand that if you don't, in fact, support behavioral health of children and their families, everything else falls apart.
Especially in chronic illness care when the specialty provider is really the primary provider.
We think some about the patient, we think a little bit about the parents, and we almost never think about the effect that it's having on the rest of the family, the siblings in particular.
There are lots of barriers to doing this. One is time.
There's also issues around feelings of inadequacy to address certain issues.
It's just lack of resources.
You are expected to be strong.
Sometimes we, as patients, kind of silo our concerns. And so if I'm going to the gastroenterologist, I'm only going to talk about everything from my mouth down and not my mouth up.
When we went to Children's, they recommended that my sons talk to a mental health professional. And first I'm like, they're not crazy. But I had to get past what I had learned, the stigma associated with seeking out a mental health professional.
The principle of if you're on an airplane and you need to, use oxygen, you always put it on yourself before you put it on someone else. But what I realize now is that until mama has what she needs, that baby can never thrive.
It took me a long time to realize that it's okay to do something for myself and not feel guilty about it.
We get to our pediatrician for the first time with all 4 children. And I walk in, I have one with a G-tube and oxygen. I have one child that's beeping because he hears the machine beeping. He's 3, and he's just beeping. And my pediatrician turned to me and said, "How are you doing?" And it wasn't the "how are you doing" where people are trying to get their papers and they're not even looking at you. It was stop everything, hold the line, how are you doing? That was the first time someone asked me how I was doing.
What would you do to make this better for another child? And my daughter looked at me and said, I wish that they would have listened to me and asked me how I felt about what was happening.
Well, how are you doing? How's your family doing? I would like that to be just like, you come in and they say, stand on the scale. You're taking your weight, you're taking your blood pressure, it would just be common practice.
There's the, hey, I'm Dr. Crandall, how are you? And there's, hey, how are you? This had to have been tough the last couple of weeks.
But if we start working with families from the time of diagnosis, very early, so that they begin to understand that their resilience is important for their child, that their emotional well-being is crucial for outcomes for the family and their child, then I think that the care team can take responsibility for partnering with families to achieve this.
Can we always provide everything that somebody needs? No, but can we do something better than nothing almost every time? Absolutely.
We need, in fact, to do this in a learning mode because we really don't know how to do this optimally. It's going to take persistence. Emotional behavioral health is really important for these families.
It's okay to ask for help.
I think we do our children such a disservice by not addressing all of the things that they're about and understanding all their needs and their dreams and their hopes. I mean, part of this is seeing the future and seeing a child who can do anything.
Not only are the families stronger, but the kids are better.